All right, we are recording. Hello, everyone. My name is Jessica Trimble, and I am the Director of Communication and Outreach for Indiana Disability Rights. And today, I'm so excited to virtually interview Barbara from NAMI Indiana. So, Barbara, I'll let you introduce yourself.
Well, hello. Good to see you on this video call. So my name is Barbara Thompson. I am the Executive Director for NAMI Indiana, which is the state chapter for the National Alliance on Mental Illness.
So, Barbara, how long have you been at NAMI Indiana?
Okay, so it actually goes back to me starting with NAMI Indiana, taking a program. I actually came through as someone using one of our services. I took our NAMI family to family education class. After that, it was so impactful for me that I actually started volunteering with NAMI Indiana. So I'd have to go back and look at when I actually took the class, but I've officially been on staff for about 5 years.
So, that's got to be a really interesting perspective to come from a person utilizing a service or utilizing the training to be the executive director. How has that informed your leadership style and your view of NAMI Indiana and the programs you run?
I think the biggest thing for me has been that it helps me to know the impact of the services that we're providing to people. I took that education class with my mother, and it's funny because I actually just took it as a support to her, like to go with her so she'd have someone to go with. But it was obviously impactful for me, and I think for her too, as she continues to be a donor also. But it really helps me to understand why these programs that we are providing are so important, because it's not something that's as easy to measure as the wonderful work that like food pantries do. It's a little bit easier to say, well, we fed this many people, or we've provided nutrition. It helps me to understand just what that impact is, and hopefully better explain to people who either need our services or who are interested in donating or even volunteering with us, what that impact is for an individual and a family.
So, what do you like about your job?
I started as a volunteer and then started doing exactly what you're doing with communications here also, and moving to executive director. So I've had an opportunity to kind of see different aspects of what we do. And so I think the thing that I like to do the best are those outreach things, which I don't get to do as much with being executive director, but because you're kind of doing a lot of the admin things. But I really do like the kind of getting out and talking to people about what it is that we do. So that's kind of my favorite thing to do.
So when you're talking about outreach activities, what areas of outreach does NAMI Indiana normally participate in, or I guess before COVID, right? Because that's all transitioning. So what were some of the places that you really enjoyed meeting people?
Really all over, because you get to go to different events, and I'm sure you do things like tabling, and maybe other people think that that's completely boring, but I love just kind of being at some event, or even like a program where you have a bunch of people who are coming together, and we're just one of the many tables maybe, and people are coming by, and you get to hear people's stories. Like when they hear that you're with a mental health organization, people really start to open up because they know they're in a comfortable place to be able to discuss what's going on and not feel that stigma, and really get a connection with people. So you really get to hear people's stories. So that's one of the places that we do. We try to do events and welcome people to the conversation. We have presentations that we do. I love getting to do events where we have presentations. We have a couple presentations. One is called NAMI in our own voice. And it's local people who are talking about their own recovery story and how they're living well, even with a very serious mental illness. We have another one that's called NAMI Ending the Silence. And this one is specific to young people. And so we have young people share their story of living well, again, with very serious mental illnesses that do impact people's lives. That's the thing about mental illness. It's an invisible illness, but it greatly impacts your life in so many different ways, whether it's for young people, their ability to go to school, or for people working, or just being, really being able to live out your life. So those are some of the things that we try to do now that we're in COVID. We're doing more of these, which is great too, so we're reaching different audiences who maybe didn't see us before. So now we've tried things like Facebook Live, done our fair share of Zoom events. So it's been exciting to try these different platforms and, again, reach people who maybe didn't get to see one of our in-person events.
So earlier in our conversation, you talked about how you're the executive director for NAMI Indiana. Can you talk about the differences between NAMI Indiana and NAMI and explain that a little bit for me?
Yeah, so NAMI is actually, so when we talk about NAMI, we're the largest grassroots mental health organization. And what we have is we have a national NAMI that really sets the tone. They create our programs with people who are very experienced based on evidence. So they create our programs at the national level, and they're a great resource for us. And then we have state organizations. So I think we have 48 NAMI state organizations around the country. And as the state organization, we are tasked with making sure that in our individual states that we're getting the programming to that grassroots, to those local communities. So we actually have NAMIs, local NAMIs, we call them NAMI affiliates, in different areas. Here in Indiana, we just got 2 new affiliates. We haven't even announced it yet, so you guys are, we've got 2 new affiliates. So we're at 15 NAMI affiliates around the state of Indiana. And places like South Bend, Evansville, Muncie, and Terre Haute, it's one of the new ones. So we have them all around the state. And what they do is we take those NAMI national programs and we get them to those local people who have that passion and drive to provide those classes, to provide presentations and just other awareness events, advocacy at that really local grassroots level. So we're like kind of this connector as the state organization. We provide them with training so that whether you're in Evansville or you're in South Bend and you take that NAMI family to family class, you're getting the same information, you're getting the same quality information. And so that's what we do at the state level. All of our NAMIs are obviously looking to help people and families impacted by mental illness to live the best lives that they can. And that's going to look different for each individual. But we want to really provide families and people living with a mental illness, we want to provide them with hope and be able to see people living in recovery, and that is a possibility.
And I imagine at the affiliate level, it's great to hear from somebody who's a member of your community or maybe just lives in the next county over to strengthen that connection, that somebody close to you or somebody that you might be able to develop a relationship has some experience that's similar to yours that you can connect with. Because I think that's what's challenging about Indiana is you might meet somebody at a conference in Indianapolis, but if you're from Valparaiso and they're from Evansville, that's pretty far apart. So it seems like these affiliates are a nice hub of connectivity and relationships and support for other people.
So what you just touched on is, I think the key to the NAMI programs is that you have peers who you can go to, and they're your peers. They live where you live. They're your neighbors. They understand your community. And all of our programs and volunteers are themselves people living with a mental illness, or they're a family member of someone living with a mental illness. And so what you really touched on there is what NAMI is really about, are those peer programs that I can look at you and that kind of those unspoken understanding of what you're going through. If I tell you, oh, my loved one, we're experiencing this, and we don't even have to have this super long conversation because you've been there, and you can just kind of say, yeah, I know that's hard, and we can get that, we get it.
And I think something that you stated that is so important is you are all creating a safe space to where I'm not going to be judged for my mental illness. It's understood that it's just something that's a part of me, and it's not because of something I did wrong or something that is to be ashamed of. It's just part of who I am. But unfortunately, we live in a society that still doesn't feel that way about mental health and behavioral health. So I imagine it's got to be a place people might be able to relax a little bit and just kind of take off some of that disguise or take off some of those layers of what they're trying to hide and actually be open, which has got to be beneficial for kind of a healing process, or even just on your journey to be able to be who you are and talk honestly about what's going on with you.
I think you just helped to best explain why I enjoy doing those outreach events. You reminded me of the times that we've gone into these events where, let's say, a NAMI in our own voice event, where you have two individuals who are living well in recovery, and you start off with sometimes the people who come to the event know each other, maybe they don't. But you have this presentation of people talking about their mental illness. It's an interactive presentation, so our speakers talk about their mental illness, but then they invite you to ask questions. And I have been able to, watch as people come in feeling like strangers, feeling a little bit reserved, and like you just said, they relax and they're able to talk about their loved one or their self and talk about their mental illness. And I've literally been able to see people come in, and nobody comes to, let's be honest, nobody comes to a mental illness event because they want to, it just sounds like the happening thing to do. They're coming for a reason, because they needed something, and it really has allowed them to just kind of say, you know what, this is what's happening. And I've been able to see that so many times. And so, yeah, you really just helped me explain why do I really like those outreach events, because I've been able to see with my own eyes that process of just being able to relax and go, guys, here's what I'm experiencing.
And I will say in the description of our video below, we will link to NAMI Indiana's website, and we will link to a listing of those affiliates, so we can make sure if people are watching this video, they want to know locally where they can go and talk to people or meet people, or I guess in this virtually meet people, we'll make it as easy as possible for them to find those affiliate chapters, because I imagine you don't have to go too far to find one, which is great in Indiana, since we are such a rural state, as you and I have talked about before. Finding those local connections is even more important when you don't want to drive to Indianapolis, or you don't identify with Indianapolis because it's a bigger city and that's just not your life and what you know. So we'll make sure to have those links in the description below. So 2020, Barbara. What's new? What's been happening?
It's been a breeze. It's been a breeze.
So I think, obviously, as I said before we started recording, I feel like life is now pre-COVID and post-COVID, or during COVID. So as everybody else has been impacted, how has the work of NAMI Indiana been impacted the past few months? And what kind of changes and trends have you been seeing during isolation and quarantine?
So I always try to look at things positively, right? And so if I'm going to look at the silver lining of having to go through a pandemic, we are retooling the things that we're doing to obviously do things more virtually. So that's really sped up our ability to provide services online. And these are going to be things that as things ease and as we go back into having what we hope to be, whatever our new normal is going to be, where we'll have in-person events, but we've seen that we are able to reach new and different people who where they are, literally. And so this, being able to do things virtually is going to be a new stream of programming that we have that can reach people, exactly where they are. And we're hoping that it can reach into new and different communities, and we're seeing that. But then there are going to be some people who still, need that in-person connection, and that's great too. So we want to be able to provide that. So that's kind of, if we're looking at the silver lining of everything, as we try new things and we're forced to try new things, hopefully, now we're able to get this programming to people sooner than we would have had there not been a pandemic.
So in this pandemic life that we're living right now, what are some of the changes that you've seen in mental health delivery services, conversations about mental health? I feel like maybe people that maybe had some challenges with their mental health, but were able to manage it through different ways. Once we got thrown into quarantine, some of those normal ways of managing your mental health changed, right? Like you can't get to the gym, or you can't do certain things, or you can't go be in person with your therapist. So how have you seen changes around services and discussions about mental health over the past few months?
Well, the biggest thing that is being talked about for, advocates as well as, people working in the mental health world is that move to virtual. And there are some positives and challenges. The biggest takeaway, I think, again, is being able to break down some of the barriers that there were for getting the telehealth type services out there. And it kind of, again, forced that door wide open for people to be able to get their services virtually or, over the telephone. Because if you can't do it in person, you still need to make that connection as best you can. I'm hearing from clinicians that, they're able to serve more people. But we have to be careful about that too, because we have to think about the individual who's providing the services. If they're going back to back to back to back, they need some downtime too. So it's going to be some trial and error and seeing kind of what the best practices are for people receiving services, people providing services. Another challenge is going to be you talked about, Indiana having so many rural areas. Are they able to have, this type of virtual setting where it takes so much, broadband or whatever the term is for, being able to push out this much, audio, video, all at the same time on an internet line. So, so those conversations are happening, and, as NAMI Indiana, we want to be able to provide that voice of the people who are receiving the services, and what does that look like for them? What's best practices? And we definitely don't want the pendulum to swing too far where you can only do it online. Again, we need those in-person connections also. So this has been pushing what people have been asking for, kind of opening that up. But we just kind of need to see some give and take. What's the balance?
Yeah, it's interesting to see that the conversations changing around internet access and high-speed internet being a necessity and not a luxury anymore when it comes to healthcare services, education, things like that. And I think sometimes, I know you and I live in central Indiana. Sometimes I think people in larger cities forget how rural Indiana is, and how it's great that you can hop online and have a hotspot if you're working somewhere and get what you need. But we need to remember our Hoosiers in rural areas where that's not an option to have Wi-Fi or have high-speed internet. So I think it's interesting to hear so many different sectors converging around this topic that maybe of internet access that maybe we didn't think we had in common before, but now it seems like so many sectors are going to be have been examining that as things move forward. So now that, oh, sorry, go ahead.
I was just going to say, I think you started off saying that, we're looking at it now more as like a public need, because it can connect people in so many different ways. And, maybe before we thought, having an internet connection and a computer, that was luxury. Well, now I think we're really seeing it as this is a way to connect people in so many different ways. Obviously we've seen in education, now we're seeing in healthcare, that this probably should be looked at different.
And I also am curious to hear your opinion. I know that for many people in cities and rural areas, transportation to providers is an expensive logistical challenge sometimes. So how have you heard about the pandemic actually alleviating some of those barriers to getting to services, because you can eliminate the transportation costs and logistics and time?
For us providing our programs, I'm sure we have, we've been able to connect with people who had the transportation issues before, and we have. But the same connectivity issue of the internet is kind of hitting those same people who had, they were too far from services, in the same way that they're too far from, connectivity, internet connectivity. But we certainly, for our programs, so we have support groups that we're providing online. So we certainly have been able to get with people, or they've been able to, get with us through an internet connection or even a telephone line. We've been able to do that. And from what I hear with some of the community mental health centers, they also have been able to connect with people that they just couldn't get to over the phone. So it has reduced that space, where you can't get to someone, or they're too far from services, or they're too far from their community mental health center. So I have, kind of been on some calls where they're talking about that they have been able to connect with some people, and there's still challenges. And I think it's going to be finding that balance of, maybe you do phone calls, for this type of visit, and then find a way to get them, in person, every, I don't know, 6 months, or, whatever the good might be for that individual.
I think that's a really interesting point you brought up, is the individuals that are most impacted by lack of broadband internet access and access with computers, because obviously you can have broadband, but if you don't have an actual tablet or computer hooked up to it, it doesn't really help, are also impacted by the lack of transportation. I think that's a really good, an important point to think about. I think we, especially those like myself who, when my internet's slow, I get annoyed, or it goes out, but it's not out that long, that what's a mere annoyance for me is life for other people. So I think it is, I always have to remember the diversity of our state when it comes to rural and urban settings, and remember that a lot of our state is still rural and has very different needs and different barriers than our urban populations. Mm-hmm. So what are some of the things that you do hope stay around, your silver lining. You know, you talked about what are some things you hope stay around after. Again, I don't know if we're ever going to be after COVID, but as things open up a little bit more, what do you hope stays the same, and how do you see this kind of impacting the future of mental health?
So the things that I really hope stick around, and we're going to make this the effort to make sure that, we are still able to provide some of the virtual programming, especially around our support groups, because our support groups are really something that's there for people as they need it, when they need it. And so people who were challenged by transportation or whatever other means, or just distance, because although we are in a lot of Indiana, we're not in all of Indiana. And so there's still people who need that support and ongoing support from peers. So that's a line of programming that we will continue, and I hope that, that's going to bring more connectivity and support to people who just, for whatever reason, either can't make it to an in-person one, that they can do that through the computer. What was the second part of your question?
Just how, and actually I'll kind of segue into this, is how do you think this is going to impact the legislative session coming up in 2021? I know NAMI Indiana does a lot of advocacy work on policy. So how do you think COVID's going to kind of impact our future?
Well, the big impact is going to be financially, right? So what we got July 1st, the governor has asked all of the state departments to cut, I think, 15%. So kind of across the board. And so how is that going to impact different agencies and different programs within those agencies? Money for the programs come from all these different areas. So it's like trying to figure out this matrix of funding. So what's going to be impacted? The legislature is going to have to figure out how to make sure that people are still getting what they need. People's basic needs for healthcare are being met. So, that's kind of on my mind, like what's going to happen to the people who need services. Well, that's going to remain to be seen. And then, how much is the state going to be able to support the telehealth services? I think Indiana was one of those ones that was already kind of lifting up telehealth services generally, but this obviously, again, really opened those doors up. And so what's that going to look like? What are they going to say was going too far, or maybe what's not far enough? And some of it's going to be not just at the state level, but at the federal level. The largest payer of mental health services is Medicaid. So what's going to happen? What's going to happen there? So there's a lot of questions, and so we're hopefully we'll be ready to talk with the voice of people who are experiencing the changes, and let their lawmakers know this is not working, or thank you, now we're able to get this, so let's continue to be able to provide this. So yeah, let's wait and see.
I know. There's so much that's giant gray areas right now. Like, we have lots of questions, but not enough answers, I think. And I think reality keeps changing on us too. Like, I feel like every time, at least within my home, my family, we figure out a schedule, or we think we know where we're going, something changes. So I will say it's been a very humbling few months of recognizing that I am in control of nothing anymore. So I am with you on this ride. So if individuals are watching and they want to learn more about NAMI Indiana and your work, or to stay abreast on some of these, funding changes or impacts on services, how can they get to know a little bit more and keep in touch with what you're doing?
So we've got our website, namiindiana.org. can follow us on Facebook, Twitter, Instagram, and they're all at NAMI Indiana. And you know, you talked about connecting to our local affiliates, and that can be found on our website. Also, there's a nice little map, and you can click on those and provide you with the contact information for them locally. We do have a helpline, like a resource helpline for folks. You can find that on our website too. So that's available during work hours, you know, Monday through Friday, 9 to 5. That we can try to help connect you with what resources are available, maybe through the state, or, you know, we a lot of times say, well, that's, you know, something that maybe Indiana Disability Rights can help you out with, and provide you with those resources. So yeah, namiindiana.org, or Facebook, Twitter, Instagram at NAMI Indiana.
Great. And in the description of the video, I will make sure that we put all of these links and all of the handles for all the social medias to make it easier for people to find you. So with that, Barbara, is there anything else that you want to share with us about your work, or as things move forward? What do you want to end with?
Well, I think, you know, we always want to make a call to people to, you know, either take part in our programs, or you can volunteer. If you're somebody who's living with a mental illness, we want to hear from you, because you are really able to provide that source of hope for other people. Just telling your story. Here's what I went through. Here's how I'm able to live well now in my recovery. Your voice is really important to helping other people have hope. Because as you probably know, if you, particularly when you're, you know, first diagnosed with a mental illness, you don't know where that's going to go. There's so much stigma out there, and so much, you know, so many movies that have just made it seem like it's something that it's not. We have some really great stories that you can hear, and they really do provide you hope. That's another. There you go again. That's another reason I love our outreach events, because I get to hear more of the stories from our volunteers about how they are living in recovery, and it just provides that hope. And so when I'm talking to people who are, you know, kind of in the depths of the, you know, their family's mental illness, I just want to be able to provide to them, like, there's hope, recovery. What we try to say is recovery is not only possible, but it's probable. You know, you're much more likely to live in recovery than stigma allows you to believe. So please reach out.
I don't know of a better way to end it. That's so great. I love that recovery is not only possible, but it's probable. I think that's definitely something we don't hear enough of, even though it's the truth. It's always trying to fight those things that are more pervasive. So Barbara, thank you so much for taking the time to chat with me this morning. It's been such a joy to see your face, to have some human interaction with somebody other than my family, who are great, but so, and I also want to thank our interpreters, Christina and Bethany. Thank you so much for being on and sharing your skills with us. So with that, thank you so much, and we'll make sure this gets posted with all of those links to all of your resources.
Thank you.
Thank you.